So I think when people ask whether this bill, the Universal Primary Care Bill, is affordable, it's important for us to recognize that Vermonters are already paying every single penny of the $6.8 billion that we're going to spend on health care this year. The problem is that it's coming from people in very, very harsh ways. There are people that end up having to lose their homes, people that end up having to defer paying for their children's clothing, or having their kids being unable to attend camp. There's a lot of sacrifices that people make, but let's not forget that every single penny comes from Vermonters' pockets. It's either in the form of some taxes, our payroll taxes, Medicare and Medicaid is paid through taxes. Our public employees are paid for mostly through property taxes. We have out-of-pocket payments, and then there are people that just pay privately for health insurance out of their pockets. So every single penny comes from us. The other thing to remember is there's more than enough money floating around healthcare. So $6.8 billion, is that enough to cover everyone? Absolutely, for every medical need they have. So we do know this has been studied again and again. We have to spend the money differently, however, because 34 cents of every healthcare dollar is spent on essentially administrative paperwork, if you want to call it that, hiring administrators to collect and pay for healthcare. There has been more than a 3,500% increase in the number of healthcare administrators since 1970 in healthcare. Those people all have salaries and benefits attached to them. In the same time frame, we've only seen a 150% increase in the number of nurses and a 150% increase in the number of doctors. So that's the scale that we're talking about. We're spending way too much money on administration in healthcare. If you have a universal healthcare system that is greatly simplified, and you could cut the amount that we spend on administration in half. It's been shown in study after study. We've had studies done in Vermont. That's why you don't need to raise any extra money to pay for health care. You just have to raise it from different pockets. Those pockets have influence, which actually makes it very difficult politically. But make no mistake about it, there's more than enough money in health care to pay for all the health care that all Vermonters need and all Americans need. I think it's important also for us to recognize that this bill actually has tripartisan support. There are Republicans who've signed on, there are progressives who've signed on, and there are Democrats that have signed on. So the reason this appeals to all parties is because their constituents, all of them gain something. So everybody pays based on their ability, but everybody gets a benefit. So certainly it's understandable why this would appeal to people who tend to be more politically conservative, because actually it is the most economically conservative legislation. You're basically making healthcare more affordable to more people. They can spend then more money in the economy. So it has an economic multiplier effect as well. So it certainly makes sense to do this for those reasons. So in terms of would universal primary care bring more people? A universal primary care system, particularly one that promised an eventual phase-in of the entire system, would be particularly attractive, first of all, to doctors. We had a study done a number of years ago, it was actually a poll, where 200 doctors said they would move to Vermont if we had a publicly funded universal healthcare system, and I believe 60 of them were primary care. It's very attractive because it simplifies the conditions of practice. You only have to worry about one payer, one set of rules, one set of regulations, rather than what we have right now, which is an administrative nightmare, particularly for primary care. So it would be attractive for primary care clinicians to come to the state, but also for people, entrepreneurs, people who want to start a business but are afraid to because of health care. It would be incredibly attractive to them because they would have health care guaranteed.